So your study evaluated a targeted radiopharmaceutical treatment for kidney cancer. Many patients aren't super familiar with this approach, so could you explain kind of how it works and why the results of your study are encouraging?
Yeah, so radiopharmaceutical therapy is basically where you have a target on a cancer cell and you have a molecule that binds that, but that molecule itself is bound to a radioactive isotope. So essentially it's a targeted radioactive treatment. So you're bringing that radioactive isotope to the cancer cell and you hope that radioactivity can then enter the cell and kill it. This is a treatment that is more commonly used in GI and prostate cancers. And what we did in this study was to use Pluvicto, which is PSMA 617 lutetium, which is approved in advanced prostate cancer. We looked at that in patients with kidney cancer because the target, PSMA, is actually there in kidney cancer too, around the blood vessels in clear cell kidney cancer.
Looking ahead, how do you see radiopharmaceuticals kind of fitting into the future treatment landscape for kidney cancer?
I mean, in my opinion, radiopharmaceuticals are the next frontier of cancer medicine. If you think about historically, we've had chemotherapy in the 60s, 70s, biologics, immunotherapies, and then more recently antibody drug conjugates. In the next 20, 30 years, radiopharmaceuticals are going to be the next sort of class of therapy. And they're already entering, as we've talked about, prostate cancer, GI cancer, but they're now going more mainstream into other solid tumors because we've realized if you have a target, we now have the chemistry, the capacity to link it to a radioactive isotope. And if the cancer is radio responsive and responds to that, then that class of therapy should work in other diseases.
What makes KCRS such a valuable meeting?
So I think the fact that it's small, it's intimate, it's focused just on kidney cancer, it brings together the leading experts with kidney cancer as the focus. I think that's unique because other big meetings, you have other things being presented, even within GU. So this is very focused, it's small, intimate, and it's relaxed, so it's a great setting to be here.